The National Housing Strategy Act, also known as the NHSA, recognizes housing as a human right. Under the Act, the federal government has to reform housing laws, policies, and programs from a human rights perspective and involve communities in meaningful ways. The Act establishes accountability tools, including the Federal Housing Advocate, a National Housing Council, and review panels. The Federal Housing Advocate monitors programs run by federal departments and agencies that affect housing. This includes whether they're living up to their human rights-based obligations in the NHSA. The Advocate receives submissions from the public on systemic housing issues and uses that information to make recommendations to improve Canada's housing laws, policies, and programs. The Advocate can review the issue. In some cases, they will refer it to the National Housing Council. The Council will establish a review panel to examine the issue more closely and make recommendations. The Advocate also provides reports and recommendations to the Minister. There is a homelessness and housing crisis in Canada. It's important to remember that adequate housing is a human right. Reflecting that fact in policy and programming is the most effective way to respond to this crisis. As federal public servants, you have the responsibility to integrate the right to adequate housing into your policies, programs, and laws. The NHSA commits the Government of Canada to progressively realize the right to adequate housing. Progressive realization means Canada must set specific timelines and goals in its housing strategy that make tangible progress towards the right to housing for all. It also means Canada must prioritize the most disadvantaged groups and those in greatest need. Progressive realization means that governments at all levels have an obligation to create the conditions to fulfill the human right to adequate housing for everyone, use the maximum available resources, apply all appropriate means, including the adoption of legislative measures, prevent discriminatory policies and practices, ensure access to justice for individuals through administrative and judicial mechanisms, and prioritize policies and programs for those in greatest need. Inadequate housing and homelessness are complex structural and systemic problems. All levels of government have a duty to respect, protect, and fulfill the human right to housing. Housing is an important precondition for other human rights, like the rights to life, vote, work, health, social security, and education. This connects housing to countless policy areas, which may include your area of policy or programming. Incorporating the NHSA into policy making can save time and money in the long run. A human rights-based approach to housing can help reduce costs associated with healthcare, homelessness services, the justice system, and other social expenditures. Homelessness is not a result of individual characteristics such as gender, race, disability, age, income, immigration status, Indigenous identity, or sexual orientation. These characteristics are linked to systemic disadvantage, structural inequality, and a legacy of colonialism. These inequalities continue to exist in many areas of federal laws, policies, and programming. Areas like healthcare, child welfare, immigration policies, Indigenous rights and reconciliation, infrastructure, climate action policies, veteran services, jobs and wages, access to social benefits, access to housing, criminal justice, and investments and services in northern and remote communities. Homelessness or inadequate housing can affect a person's sense of community, their ability to work, or their mental health. It can affect many aspects of their life which may concern your area of policy or programming. Here are 7 practical tips you can use to meet the standards of the NHSA and advance the right to housing in your policies and programs. Tip number 1. Consider whether legislation, policies, or decisions will have a positive impact on the right to housing for those who are most disadvantaged. To prioritize the most disadvantaged groups and those in greatest need as set out in the NHSA, The Federal Housing Advocate and the National Housing Strategy put particular focus on people experiencing homelessness, Indigenous peoples, survivors of violence, seniors, people who identify as 2S LGBTQI+, people with physical disabilities, people with disabilities related to mental health or addiction, veterans, young adults, racialized groups, new immigrants and refugees, and other disadvantaged groups. Women and gender-diverse people within each of these groups are disproportionately affected by inadequate housing and homelessness. Tip number 2, apply a housing lens as you implement other federal priorities. Housing cannot be addressed in isolation. It is connected to many other policy and program areas. Incorporating the right to housing and NHSA commitments will lead to better outcomes. For example, consider housing when you are working on initiatives such as GBA+, implementing the United Nations Declaration on the Rights of Indigenous Peoples and reconciliation efforts, Canada's poverty reduction strategy, addressing systemic racism and discrimination, pandemic response and recovery, and the needs of northern and remote communities. Tip number 3, engage and be accountable to individuals and communities with lived experience of inadequate housing and homelessness when designing and delivering your policies and programs. This approach offers rights holders the opportunity to be directly involved in work that affects them. It helps governments and agencies identify issues more effectively and create programs that are more responsive to real people and their lived experience. Tip number 4, establish clear targets, timelines, and indicators. Engage rights holders to help ensure that these goals are realistic and to identify areas that still need improvement. Measure progress by how outcomes impact real people and meet their actual needs. Tip number 5, collect disaggregated data, both quantitative and qualitative, to better understand the impact of government laws, policies, and programs on diverse groups and on those most in need. This data will help you create more effective programs. It can also help determine if you are meeting your targets, timelines, and indicators. The Federal Housing Advocate can also use this data to understand, measure, and help make recommendations to correct the various factors that contribute to homelessness and inadequate housing. Tip number 6, take an all-hands-on-deck approach. Collaborate with other federal departments as well as provincial, territorial, municipal, and Indigenous governments. Tip number 7, incorporate the human right to adequate housing when you provide advice to decision makers, write decision-making documents, and create policies and programs. You can do this by designing housing-related laws, policies, and programs that meet the NHSA standards, and by reporting your progress in documents like Memoranda to Cabinet, Treasury Board submissions, and in drafting instructions for new laws. Implementing the National Housing Strategy Act and the right to housing will take a coordinated effort at all levels. Guidance and accountability mechanisms, like the Office of the Federal Housing Advocate, are here to help. For more information, visit the Housing page on the Canadian Human Rights Commission website.